So go into learning science. What is learning science? That's you've always talked about it to me. So tell them about it.
And obviously, the first thing I'm going to do is give a shout out to Todd Maddox.
Okay,
right?
Chad Maddox. Okay.
He's the one who
In
taught
Austin,
me everything I know.
Texas.
Austin, Texas.
Yes, yeah.
I know he'll be watching this. So
Yeah.
what Todd has taught me, and he spent 25 years in basic science research studying this, and has now brought this into IKONA and has taught so much of the healthcare and virtual reality worlds about this, is really the marriage of psychology and neuroscience. So basically, in its simplest form, it's how we're wired to learn.
Yeah.
And
we're all wired differently to learn, right?
Well, here's
with the commonalities more important.
We're wired the same. The human brain is the human brain, and understanding how it's wired and how that impacts the ways we learn has incredible implications for healthcare settings, whether it's patient education or provider training.
Yeah.
So it's simply put, we're wired to forget, right?
Okay.
The human brain is wired to forget. We all know this. It's why we cram for tests and we forget the information. It's why you learn something 1 week and a week later you only remember a fraction of it. This has actually been known for 150 years.
Yeah.
A guy named Ebbinghaus 150 years ago did this forgetting curve. You might have heard of it.
Yeah.
Right? So ideally, you learn something.
Yeah.
You can actually comprehend that information. You retain that information. And then over time, you are giving spaced micro-learning, so digestible content over time.
Yeah.
You're retested, so you can maintain high comprehension levels. So you can shallow your forgetting curve. Basically, you can take short-term information and transfer it to long-term memory.
Yeah.
And you can hack the human brain without anyone actually knowing it. And think about what that would do for a patient who, you're CKD3, and you're saying, hey, we have this nutrition information.
Yeah.
They're not getting it. They don't know what phosphorus is.
Yeah.
What if you could suddenly get them to remember that snippet, and suddenly they're changing their behavior based on information they learned? Or, hey, we want this patient to go home on home dialysis, on home hemo, but we don't know how to get them over the hump of cannulation. We don't know how to get them on machine setup and safety, or they discontinue a year later because they weren't adequately trained. Those are all learning problems that we can solve. So learning sciences is really fascinating.
And so I find it interesting in kidney care, you have this dichotomy between patients and patients and doctors, right? And it's true in every field. Like the knowledge base is higher in doctors. But in kidney care, especially, like the patient population is poorer, older, may have cognitive decline, and you're trying to teach them a really high yield or high concepts, big concepts.
Yeah.
And so that's always been like that frustration point for me. I remember like even seeing, like the average patient consent form is written in 7th grade English, right, or 6th grade English. Sometimes even 5th grade. I remember I was in Louisiana. I think it was like 5th grade or something like that. And so it's hard to transfer such complex ideas with simple language down to that level. You know what I'm saying? And
even that is a science. Like being able to communicate complex topics is overlooked, but it's a huge opportunity.